I think all of this boils down to the personality. I think I enjoy challenge. So as a person, I'm not the type of person who would like to just put my feet up and do nothing. I'm always working really hard. I'm always looking forward to a challenge, waking up early, having things in order. I think the greatest things that give me pleasure and relaxation is to be able to sleep well at night, and that's when I do my job very well. I'm from Iran originally, so I did my undergrad training there. Then I came to the UK 2005. I had to re-sit the final exams, did all those exams, and then I worked as a VT, just like newly graduate dentists would do in the UK. And then I just carried on working in general practice. At the same time, I was doing a lot of postgrad training. I always liked to develop, learn new things. And then I was a general dentist for 10 years in the Southwest, and just got to a point where I thought I want more out of my career. I want to become better at what I do. I always care a lot about what I do. So for that reason, I decided to go and become a specialist. And a specialist means that you actually have to train significantly more. So the undergrad dentistry is 5 years. To become a specialist, you have to do another 3 years full-time training. And it's all about having the abilities and having the skills to offer the treatments that otherwise wouldn't be available. So a general dentist cannot do the kind of work that I do. They just can't do it because they're not trained for it. That's number one. Number two, they don't have the equipments that I have. So I have microscopes. I work with microscopes, and I work with a special apex locators. I work with the CBCT scan. Without these, even me with all my training, I wouldn't be able to perform certain treatment. The favorite thing is being able to save teeth that otherwise have to be extracted. People should be able to have their own teeth. And that's basically where we come in. What we do, we're dealing with bacteria. So when the bacteria is settled in the tooth, obviously the sooner you can get to it and do something, the better. It will be a higher chance of success. As soon as you mention the word root canals, people think it's, oh gosh, it's going to be so painful. Whereas actually, I strongly believe any dental procedure, if you fail to adequately numb the patient, will be painful, even as scaling and cleaning. And managing the pain is one of the biggest part of our training. So as I was training to become a specialist at the Eastman Dental Hospital in London, one of the biggest parts that we work on is to adequately anesthetize a tooth. So sometimes people come in, they are in severe pain. You can't just let them go with medication. You have to do something for them. And I have patients that I work for and they fall asleep. That means it shouldn't be painful then that they fall asleep. It just takes a long time and they are relaxed. So that's fine.